We're back.
Hello.
Did you have a good lunch break?
I did. I got some stuff done, ate some lunch. Here we are. How about you?
It was good. I got some coffee, which I did not have before I had my smoothie, so I'm getting caffeinated, which makes me happy.
Yeah, I debated having a second cup, but I think I gotta stick with just one.
I gotta make sure that you don't stay up all night.
Yeah. Sometimes I get it in my head. I'm like, oh, maybe I could have another cup and it would make me feel better, but I think I usually come out worse than if I just have one.
I know. I feel the same way. And I sometimes I know that and I'll do it anyways. Now, sometimes I'll have a matcha later in the afternoon and that doesn't have the same effect. But
Yeah. Yeah,
I
one of my friends has been trying to like move from caffeine to tea. And sometimes she'll text me in the morning and she's just like this isn't working. I need coffee. Like,
I have cut coffee a few times in my life and I've always come back to it. That's all I can say.
I just really like it.
I do too. It's very much like a ritual for me, and it's just like the warm coziness and the sitting in my mug. And I do like tea, but it does not have the same cozy factor to me.
Yes. I have an espresso machine that I love. And so I just make myself lattes and I just love the like you said, like the ritual of it and like
Yeah.
making it and I'm like and it's so yummy.
Yes. And it's meditative.
Hmm.
It's gonna be a long day. Okay.
Yes, it is.
I know. I keep like seeing, I was like, I know my husband, we are working on a proposal tonight for something, and I was like, well, we'll be up all night anyways, we will be. So we'll just keep on keeping on.
And say in the past years, my election tradition has been to just watch like a movie and ignore
I need to
all
do that.
news.
I get sucked in and then I can't stop. And I'm like, and they say the same thing over and over again, like
Yeah,
90% of the time. And yet I'm still like watching it. And I'm
yeah.
like,
Just stuck like glued to the TV, like not getting actual info. And
yeah,
it's just gonna like be found figured out like the next morning.
yeah, yeah,
But
We talking about the election.
yeah.
I'm trying so hard
I don't.
not to. My husband and I have like a whole evening plan to distract ourselves.
yeah,
Oh, I should have done that. I did not. I'm going to my mom's house. Like we're taking the kids, everything. We're going there to like eat like a really good dinner together as a family and then kind of, yeah,
Watch.
kind of, yeah.
yeah.
I
Every
want.
time, go ahead.
Oh, I was just say I want to watch. Like part of me does, mostly because I think if there's a bad outcome, I think I need to like understand. Like when something bad happens,
Yeah.
like you have to like get there. And I think
Yes.
I won't be able to like rationalize it if I don't haven't gone through like the process of it
Yeah.
happening.
You need the whole grieving process.
Yeah. One of my biggest reasons to watch is like if something bad happens, I have to like, okay.
Yeah.
It won't be, but fine.
I'm a big like distraction coping mechanism
Yeah.
person. So I go full into like I don't know, like I'll watch a movie or like play a video game or something. I'm like, I'm in a different world. Like,
We're gonna have to do that at some point. We're gonna have to find a movie and distract ourselves a little bit, I think.
yeah. I also just don't like staying up late that much. So I'm like, oh, I'm not gonna find out anyways. So
I'm a night owl. I'm one of the people who can work till like 3 o'clock in the morning. And it doesn't matter. Everyone told me it changed when I have kids. It doesn't. I will be up till 3 o'clock in the morning finishing proposals and everything else. And yes, I know my kids will get up at 6. I will never be an early morning person. I will always be a night owl. I will get everything done. And then yeah.
that's
So
just how some people work. I don't know.
How does that work when you have kids?
what? How does that work when you just get up?
Yeah.
I end up getting up, or my husband will get up with him because he's he can be an early morning person, so he'll get up with them instead. But most of the time we just get up and I'm just tired and then I'll sleep the next day. But especially if I have to get something done, if we're writing something, yeah, I'll get my best time because the kids are asleep, nothing's really happening, and I can like hyper focus in a way I can't during the day.
Wow, that is after 5 o'clock, we're done.
You're done.
Yeah. Unless I have to like really like, do have a meeting or something important, I'm done.
Yeah.
I find myself like right in the middle. Like I can't function in the morning. I'm like 10 to 2 is my perfect like thing range.
I love that.
That's when I'm at peak. Because I know, Burke, you start your day at 7 sometimes. And every time I see that on your calendar, I'm like, how is she doing it?
I used to do that for like because my husband's up at 5 every morning, or he leaves at like 5-ish. So for the hospital, so I'm like, well, I might as well get up to say goodbye because he's like gone for forever. And so then I'm up at like 5:30, and I'm like, well, I might as well just get my work done because then I'll be done at 3. But now I've switched it to be 9 to 5 because then I have a whole day before 9 a.m. and I can like grocery shop. I can go to the gym, walk my dog, and
it's
then
impressive that you do that.
But for me, it's like once I hit the afternoon point, like if I'm not productive enough, like in the morning, then I just don't do stuff in the afternoon.
Okay.
Like I only want to do fun stuff after 4 o'clock.
I can see that.
Yeah.
But I want to be like that. I want to get stuff done in the morning. But if my day didn't start till 9, I just wouldn't do anything until 9.
If I do that, then it really just backfires. Then I'm just like, well, now what?
Yeah.
I don't know.
My mom has always very much been like that. She's always been like someone who gets so much done before her day even starts. I don't know how it came from her sometimes. And my brother's a night owl too, like both of us are. And so we both look at her like, how did we come from you? Like neither one of us got that gene.
Yeah, all my like family are like early risers, and I'm just not that way. I love sleeping.
I love sleeping too. I just like to go to bed early.
Oh, yeah. The same amount of sleep, you just go earlier.
Yeah.
Yeah.
Yeah. I mean, especially now, like with the time change. Last night it was like 6:30, and I was like, it's 10 p.m. It is 10 p.m. right now.
I hate it. It made at 5 o'clock, the dogs and my children were like, why is it so dark out? It's time for bed. And I'm like, no, it's not.
No.
Keep going. We gotta keep going. All right. I think I have, hopefully my music works this time. Yeah.
Moving through the muddy tide, looking for that silver line, trying to see it down below like a treasure, find its glow, diving deep it towards the core, don't know what you're waiting for, in the depths of your despair, that is where you'll find your air. Air. Find your air. Air. You don't need a map to find what's been there the whole time. Let it float to the surface. Be the jewels that you are. Show them what your worth is. Let it float to the surface. Let it float to the surface.
Welcome, everybody. Christina, I loved your little. It's good for this afternoon. Welcome to session 8 of the DFC Bootcamp training on implementation and evaluation. Really excited for today's session. Similar housekeeping stuff to sessions before. If you can, please keep your camera on. We love to see your faces, love to get that engagement with you all. Thank you so much for being here. Really appreciate you taking time out of your day to join us. If you don't know me, my name is Fran Varga. I'm a prevention coordinator at Prevention Action Alliance, and I work with the Statewide Prevention Coalition Association. And we provide training and technical assistance to coalition leaders and members like you all. So thank you for being here. Thank you to CADCA for offering your wonderful trainers like Christina for being here. And then thank you to the Ohio Department of Mental Health and Addiction Services for making this training possible. I will let Christina go ahead and take it away to talk about implementation and evaluation. Thank you, everybody, for being here.
Thank you so much, Fran. Thank you all for being here. Welcome back for those I saw this morning. As Fran said, we're going to be talking about implementation and evaluation. So talk about you did all the hard work, you planned for it, you have all the data. Now we're actually getting to implement it. So as I'm pulling up the slides, go ahead and introduce yourself in chat. And I want to know, what is a strategy you're currently implementing? It's a strategy you're currently implementing, because we can use that as we talk through today. Let me find my slides. I've somehow lost them. Here they are. There we go. So from vision to reality, like I said, you've done the planning, you've collected all the data, you know what you're going to do. Now you actually have to implement it, right? And so this is where the rubber hits the road, where how do we make sure we're implementing well? And how are we evaluating to make sure that we're having impact, that we don't need to pivot or make any changes? And this goes for all of our strategies, whether we're talking about programs or policies. We should be evaluating everything on both like a micro level. And what I mean by that is those individual strategies we're putting into place, and then on a macro where everything's coming together. I always say that coalitions are bad about justing all over themselves. And what I mean by that is we just did a town hall meeting, or we just passed a policy, and forgetting everything that went into making that happen. So one of the things we'll talk about today is not just seeing the data change, which of course we want to see, whether we're talking about 30-day use or we're talking about some of our logic model like local condition data changing, but also how can we make sure we're tracking everything that goes into making those things change, so we can be really realistic when we're talking to funders or we're talking about to volunteers about how much goes in to making this impact that we want to see. Our goal, again, is to keep everyone engaged. I have questions throughout this session, so please make sure you're using chat, or if you feel comfortable, unmute yourself for a small group. So feel free to unmute at any time or raise your hands. And I would love to hear from you. So I'm going to pull up chat. If you please, I was put into chat, like, go ahead and introduce yourself, say who you are and who you're with, and then one strategy you're implementing. Who you are, who you're with, and one strategy you're implementing. If you've not been with us for some of the prior trainings, as Fran said, I'm Christina Clark. I hail from the great state of Tennessee outside of Nashville, but I am an Air Force brat who's lived all over the United States. I was the coalition director for 10 years in Coffee County, Tennessee, which, if you're familiar with the Bonnaroo Music Festival, that's where that's located. And I've been with CAGA for the past 9 years, training with them. And when it comes to strategies, thinking through some of the major ones that we were able to, that I feel like are some of our biggest accomplishments over my 10 years, was the social host ordinance, as well as an opioid pain clinic density ordinance, as well as a lot of our programming that we institutionalized into the school systems. And yes, programs absolutely count. I see Clark County Partners in Prevention, Catch My Breath, and other evidence-based programs count. Absolutely, and we'll be talking about some of those today. Student with relevant connections. So you're new to DFC, Alyssa says, so we're maybe looking at some things we could be implementing. Anyone else? Make sure you put name. School-based prevention, great, we'll be talking more about that. Bethany, is there a certain program that you're pushing for school-based prevention? Too good for drugs and Catch My Breath. Okay. Perfect. Please, yeah, go ahead, introduce yourself and what you're working on. This really helps us as we talk about implementation and even into evaluation. Little ways I can pull out. So Tanya says, mental health, prevention, provide TA to some coalitions looking. Okay, perfect. Like I said, at any time, please just raise your hands or put into chat. I do have some questions along the way for you to make sure we stay engaged. But a really important topic today is we're talking about implementation. I don't think we spend enough time talking about implementation, especially, like I said, whether you're doing programs or policy. When it comes to implementation, this is where we can make the pivots we need, especially when we're thinking about health disparities and health equity. This is kind of where we have to get really good at making sure we're going to have impact by keeping our hand on the touchstone and seeing the changes we can make. So first, we're going to talk about some of the foundational steps for implementing strategies. Then when we get into evaluation, what are those key tools and metrics we should be using? How do we make sure we're continuously looking for improvement? So like I said, it's one thing to know that we have a great plan to start implementing a program, but if we're not evaluating it, it really is going to impact our sustainability and our ability to make change later on. Seeing what else? The winner circle, vendor training is our next project. Love that. And I'm going to stop sharing just for 1 minute because I made sure I had this link already and then I got distracted talking about things and forgot to put it in chat. So I want to make sure that you have access to this primer, whatever you call it. I call it a primer. Some people call it a primer. I feel like that sounds like I'm from Great Britain. But I put that into chat. That gives you great, especially if you're looking, some people are talking about training up their coalition members or trying to get a better understanding if you're new to prevention and the strategic prevention framework. These primers are really great. You can download them for free. You can also request hard copies of them just to give you like a quick reference to what we mean by each section. And so I wanted to make sure you had this implementation primer to refer back to as you're going back to your coalitions. But when we're talking about implementation, like I said, I think a lot of times we kind of just go to that first box. We're like, we implement and then we're done. But there's a lot of steps that come in between and some things we can't even think about or we don't think about until we're right there at the cusp of implementing something. So really what comes into implementation are these middle boxes that we have to make sure we're ready to implement. I often say that we have things that are stuck on our to-do list a lot of times that never moves or is on our action plans that we've submitted to state or federal funders multiple times that we don't move on. But they're really great ideas, something like vendor training. Great idea, evidence-based. We know it works, but for some reason it just keeps ending up on your plan and nothing happens. That's usually because readiness is an issue and we need to be looking at readiness. So building readiness for implementation is important. It's one thing to have it, it's another to actually do it. That we need to make sure we're confirming health equity and implementation. So this is where we can take time to be like, are we making sure this is available all the places it should be available? Is every single school getting it in the same way? Are rural versus urban areas getting it the same way? Is it only happening in the county seat and no one from the rural area can get to it? Looking for confirming that health equity piece. And then, listen, this is probably like the biggest like hill I will die on is we have to ensure we have sustainable resources, especially when talking about all these great programs. You guys are all talking about incredible evidence-based programs in chat. We need those programs and we need them in our schools, but we need them to be there long-term. And so we really have to figure out a way as we're implementing a way of institutionalizing. That's why I said one of our greatest wins when I was coalition director was institutionalizing a lot of these programs, was making sure it was in their policies, making sure there was training mechanisms long-term to make sure guidance counselors continue to get trained in the programs so that if anything happened to the coalition, that these programs continued. And so really thinking about sustainability during implementation is important. The other piece, after we get out of those three, is that making sure that we also have the coalition members involved to do this. Because remember, we're a coalition. So it's not just us as staff taking this on. We really need to build up our coalition members to do this work. And so making sure during this implementation time, we're also building the capacity of our partners, our community organizations, residents, and staff to continue to implement whatever the strategy, policy, or program is we're talking about. That's why you'll hear so many trainers in the prevention space argue that when you look at the strategic prevention framework, capacity should really be in the middle with sustainability because we should be thinking about it at all times. And that ensuring sustainable resources and that community members and partners piece, we have to be thinking about that while we're implementing it long term in order to continue to have impact and to make sure we don't do what we have seen so many people do in our communities if you've lived there long enough, which is get a lot of funding, start a really great program, and then leave. And then the program dies. And we don't want to see that happening. We want that long-term impact. So you've probably seen this before. This is based off the triethnic survey and the idea that we need to move our community. So there's coalition readiness, and that's one thing. And I'm a huge proponent, if you haven't seen anything from the Watersman Center and R equals MC squared, looking at readiness and capacity and motivation, highly recommend that for looking at your coalition readiness. Here we're talking about community readiness. How do we bring our community along to be ready for what we're going to implement? And this is twofold, right? It's about the substances and then being ready to take on combating what we're seeing in substance use all the way through, like I said, this micro level of these individual strategies. And when we think about readiness, it's not just the readiness of one organization, but the people within that organization as well. So sometimes when we have sector representatives, we're like, law enforcement isn't on board. And is it, you have to ask yourself as coalition leaders, is this a total enforcement thing where we need to work with the entire department, or is it an individual that isn't ready to move forward with it? And the reason we ask ourselves that question is to figure out how we can move them across these stages. So I think about somebody I worked with all the time, which was Detective Conway from the Tullahoma Police Department. He was always farther along in readiness than his overall organization was. So then I could utilize him to bring on the rest of law enforcement on board with it. But for someone else with the school system was ready for it, but I keep getting no from one person who's kind of the gatekeeper. I have to figure out how to move that person along. So this is just a way of saying, where are we at with community readiness and extent to which the community will support the proposed strategy? Is it that they're not going to do it? They're just not going to take it on. This could be because it's so ingrained, whether it's like an alcohol issue or something, that social host ordinance just isn't going to happen. Listen, they feel like kids are safer drinking at home. That's their stance. They are in no mood to move on a social host ordinance. And then we have to ask ourselves, not that we need to throw that out, but say, how can we slowly move to getting them ready to do this in the next few years? And then what can we take on now that they are prepared? So maybe they're more likely to look at retailer access and work on vendor training. They're more in the stage 6 or 7 that we could do this. So this is just a way to tap in and say, as we're looking at implementation, where are we going to find difficulties? Where are partners at in supporting this and how we can move them along? So this gives us kind of a way, a touchstone to say, can we figure out some barriers now so that we can go ahead and make a plan of attack for how to move them along? So what are ways that we can move people along, as I'm talking about? How can we raise readiness? Well, one of the ways is to increase awareness, right? We need to just get them to be okay with it, especially if they're at that lower level where they're like, we don't even want to touch this. Like, alcohol is too ingrained. We're okay with the way things are. How do we move them? Some of this is making sure they understand the data, figuring out different ways to get data out there, ways to grow our coalitions and partners. All of those things you do with one-on-one meetings, having more talking circles, flyers, campaigns, town hall meetings, all of those things you're used to. This is where it's just about getting more strategic about it. We're really good at town hall meetings. We're really good about doing flyers and doing one-on-one meetings. What I encourage you to do when we're talking about community readiness is get hyper focused at what you're going to talk about at those town hall meetings or at those one-on-one meetings. Instead of it just being generally about alcohol use or what the coalition's doing, get really focused in on those specific data points and those proposed strategies that you know will be effective and why. Have a town hall meeting specifically about the prevention programming that we need in the school system and why. So getting super hyper focused and strategic so that we can raise that a readiness around specific implementation strategies. So I'd like to open this up to you, and like, no like wrong or right answer. This is really just about thinking through readiness. Your coalition has identified the local condition that parents are providing alcohol to youth at house parties, so social hosting. And you're proposing as a coalition a social host ordinance to be adopted by city council. What can your coalition do to build readiness for this strategy? And you can select one. So you can put in chat. A, write press releases for local news media highlighting the parties. B, meet with the city council members to discuss. C, make presentation to local parent-teacher organization or parent-teacher association about the local condition. Conduct a town hall meeting on underage drinking or other described. If you wanted to make this happen, what would be your first step? Lots of C's. There's a lot of C's. So why, I'm going to ask, since that's the number one, why would that be your first move? Readiness.
I think it would be my first move because some things are maybe culturally, or the expectation might not be there. If it's familial, it might be just something that we've done, or so just to bring awareness to some of the consequences that come from such a decision, the legal ramifications. So some people really just don't know. It's just been
Yeah.
passed along.
Yeah, I thank you so much, Marcus. I think this is really important when we're talking about community readiness. Remember, we see that the arrow going across. If we know we're struggling with that deep rooted social norm, and people aren't really talking about it, and they don't know, like Marcus is saying, getting to the parents first might be our best suited effort, getting them on board, having conversations with them about this. Because if we jump right to meeting with city council members, it might feel like an attack on parents, right? And so this is where we have to figure out where people are ready in our community, where we need to bring people along, so we don't end up with friction later on because we didn't bring everyone to the table. See, spread awareness, increase awareness based on demographic. Love that. See, it's also more targeted towards parents. Yeah, absolutely. If you were in our policy session, we talked about this morning, talked about bringing the right parties to the table at the right time, and whoever's being impacted by this. The major people being impacted by this are young people and parents. So talking to them first is a great idea, especially when we're talking, like I said, about readiness overall. Great job. We also want to be making sure we're looking at health equity and confirming it implementation. And this is something that isn't like a one and done, like you check the box and we're like, great, we've met health equity, everyone, we've done a great job. This is why, again, thinking about our previous session, talking about policy, we talked about making sure that we're evaluating that policy and looking at its impact continually. Same thing when we're talking about programs implementation. We really want to make sure that we're not doing any undue burden. So ensuring that health equity goals are being addressed, that we're anticipating needs and support among populations and experiencing inequities. So looking at, are we seeing different success rates with different populations with the program we're putting into place? Is it because we're doing it before school or after school instead of during school? Is it because it's only happening at the Boys and Girls Club and not everyone is at the Boys and Girls Club, or it's only happening in one area of the county? Or we don't have enough diversity in teachers or faculty teaching it, and we need some other people in there to make sure that we're reaching the students in the way we want to. So just thinking through the needs, and as they're coming up, making sure we're pivoting towards them. Making sure that we have methods in place to identify issues early. And this goes back to why evaluation is so important, and not just yearly, but some version of check-ins on at least a quarterly basis. Where we're saying, how is this going? Back are we getting from young people or community members, so we can see a problem before it becomes into a huge issue and we can make those pivots. And then make sure that we have agreements that have been reached with partners for long-term plans for this. So again, when I talked about institutionalizing programs in the school system, so the idea that they start working in the training process for staff, that they start making sure it's part of their plan. So anytime a student, something XYZ happens, they're going to be part of this program. Part of that long-term institutionalization of it really should be, how are we going to have evaluation check-ins of implementation to make sure that we're meeting any changing health equity concerns. So just making sure that constant evaluation and looking at health equity is part of it. So thinking about that, I have another question for you. A proposed change to school policy includes alternatives to suspension for alcohol, tobacco, or other drug violations. That's what ATOD is there. Unfortunately, there's limited funding for the assessment and treatment that some youth may require. Your recommendation, and you can only select one, is A, delay implementation until full funding is available. B, implement the policy and apply for additional funding. C, implement the policy and provide services until the funding ends. D, meet with parents to discuss the local condition and proposed policy. Or E, other and describe. So take a moment and reread and then put into chat A, B, C, D, or E. So we have a B, implement the policy and apply for additional funding. Couple B's. Tanya says D, meet with parents to discuss the proposed policy, B or D. So it looks like we're B or D. Why B? For those that chose B, either in chat or feel free to unmute. Why B? It looks like we have 3 Ds. So same thing. If someone wants to either unmute or put into chat, why D?
I put D because when you're talking about alternatives to suspension for youth, usually the parents are involved because, you know, there's either some type of thing where they're not they have to complete this program in order to continue with school. I know in our program where we have suspension, alternative suspension, the parents have to actually go with the youth with the program. So I think discussing with the parents first that, you know, we don't have any funding, limited funding for assessment and treatment, how can they be involved and engaged, you know, in helping to, you know, reduce the suspension policy and getting their buy-in so that it can be successful and the outcomes can be there. Because if the parents don't have buy-in, they won't send their kids, then you won't have no outcomes, and then you won't have any additional funding in the future.
Yeah, I think that's a great, and just the communication. That's what I always say, that community work is messy, you guys. It just is messy because there's so many different competing values, people, stakeholders, etc. And so the most we can be is transparent. And one of the things I like about D is it's really transparency about what we're trying to do and what some of the limitations will be. Looking in chat, having the policy already in place might help secure the funding. So I agree with that. So I like that as well. Being like, we have it, we're implementing it, but we need to apply. Us being like, listen, we have this great program going, we're seeing things, but we found this gap. And we'd really like to fill it by being able to assess and treat. You can start the program and gain a foundation to either grow a program if additional funding is granted or cease the program if funding is denied. The need is there. A delay in services may negatively impact students in need now. Yeah, and I think for me too, there's another component here, which is how can we tap into people who are already doing this work too? Is there a way that we can build a partnership where someone else already has funding or can help with the assessment and treatment? Can we connect? So for instance, we had Centerstone, and we do have Centerstone in Tennessee, which is a large behavioral health facility. And they do prevention, treatment, and recovery work. And we were able to work with them. They got funding to be in the schools to provide assessment and mental health support. So it could be that let's go ahead and implement the program, and let's figure out some partners we can bring to the table to maybe fill the assessment and treatment gap, or as you guys are saying, go after more funding. And this really is about having a discussion with people about this, like bringing people to the table and saying, this is an issue we're going to have. And realize the one thing we don't want is to implement the policy and then the funding just goes away, right? We want to do our due diligence and say that we know there's a gap. We know we need to assess that gap, and we need to find data and the right people to fund this. But that doesn't mean we don't need to start somewhere. And this is where that transparency piece comes really in, saying we know we need to do the right thing. Let's start here. This is our next phase, and make sure everyone's on the same page with that. Great discussion. Next, as you know, we talked about ensuring sustainable resources, that this can continue so that we keep seeing impact, that we don't end up having this great program where we have alternative to suspensions, people are invested, we're seeing great outcomes from our young people, and then all of a sudden it goes away and we're just back to suspending and expelling children. We know it doesn't work. So how can we make sure it's sustainable for the long run? And we want to look at this in terms of the materials needed, the fiscal oversight that's needed for it, and the human capital. So a lot of times when we're talking about implementation, especially when it comes to programs, we're really good about articulating the materials needed. We're like, we need this many handbooks, we need this many supplies. We're not as good at preventionists and being like, this is how much human capital we need to make this happen. This is how much teacher time or guidance counselor time or staff time from the coalition we need to make this happen. And this is important when we're talking about sustainability long run, because if we're after additional money, we need to make sure we're not just being funded for material, but for the overhead it takes for that human capital to happen. So making sure as part of us evaluating, which we'll talk about in a minute, with our programs is saying how much money does it cost to really implement this program well. And I can tell you, and if you come to the in-person sustainability, we'll talk a lot about this, but one of the things you can do is when you're planning and you have your overall action plan, putting in a column that has dollar signs on it and going ahead and saying the cost of each one of these things, whether it's to have the binders, whether it's to train people, whether it's staff time that goes into doing the town hall meeting, really gets you better when it comes to implementation about seeing how much resources are actually needed. Okay, I have another one talking about resources. A coalition has worked to ensure regular compliance checks for alcohol and cannabis retailers. Identify organizations that can provide resources to ensure each activity will continue over the long term. So, identify how each will be sustained. Organize and conduct the compliance checks. How could you ensure that you had continued compliance checks? What's something that you could put into place to make sure that you have continued compliance checks in your community for the alcohol and cannabis retailers? Who could you involve? Where could you get money? Who's going to be doing those compliance checks? So you're identifying an organization that can provide those resources that we need to make that program happen. So Tanya says, Ohio Investigative Unit, law enforcement need MOUs for compliance check. Yes. Local government, local law enforcement. Yes. So again, making sure this continues is how do we make sure if law enforcement's on board and been doing this, how they're going to be on board long-term? Is there a way to put this into policy where they will continue to do compliance checks, where the local government will fund those compliance checks? So one of the things, we were not doing compliance checks for alcohol when I first started in my coalition. So one of our biggest things was getting compliance checks to actually happen. And once we were paying for them for the first few years, and then once it was determined they were very successful, we went to the local government and said, you should be paying for these now. And so they are. So making sure as we're thinking about implementation, we're thinking about how it's going to continue moving forward. Okay, what about who could you pull? Well, we won't do every single one of these, but how could we make sure that we're providing responsible beverage service training? That's the RBST training to retailers in multiple languages. So who could you engage to help if you needed to do your responsible beverage service in a different language? How would you get a resource for that? Who could be an interpreter? So as I'm waiting and to see what pops up in chat, this is where you could see whoever you're using for a responsible beverage service. Most of them have things in different languages. So whether you can get Spanish copies of things, or we had to get Arabic copies of things. And then we were able to partner with our local school system for some of their interpreters to come and assist us during those trainings to make sure that we were getting across everything in the language that the retailer spoke. I also see interpreters from local organizations. Yeah, absolutely. Tap into the local organizations that have interpreters. If you have a group together, like whether it's a Hispanic Alliance, or like we have a Middle Tennessee Muslim youth that has a lot of Arabic speakers in it, finding different ways to tap into that. El Centro, Lorraine, UMADAOP, those are so many letters, to provide training with staff who are Spanish speaking. I knew you weren't yelling. That's funny. Yeah, so it's the idea again of tapping into resources. And what I want you to be cognizant of is it's so often when we're thinking about implementation, we just think about, like I said, the whole program, we just fill ourselves. We're just going to do responsible beverage service, or we're going to do catch my breath. There's a lot of micro steps in there and lots of little ways that we can ensure readiness and sustainability and health equity in each one of these pieces. And so thinking about, like, here, we're saying that we want to do compliance checks. There's so many different pieces to that, from organizing it to making sure we can train people to participate, to making sure we're having training in multiple languages, that we have continued recognition, to making sure we're suspending license for those who fail. There's so many parts to it that need to be implemented and sustained, and make sure we have health equity with, and that we're ready to take on. And so it's just being really strategic as you're looking through this of where our holds up, where could our barriers come up, and where are we not thinking about in terms of full implementation from all the way from when we start to when we're evaluating. So as we're talking about implementation, do you have, and I know we've talked about this a lot already, but is there any successes or challenges as you're thinking about things you've implemented? I know some of you are very new and you're just starting to implement, or maybe haven't even yet. Is there anything from what we just talked about in terms of successes and challenges, from readiness, confirming health equity, or ensuring sustainable resources that you'd like to share? And feel free to unmute.
I know one of the programs we've implemented, it's called a Magma program. It's a computer coding program in the
Oh,
inner
cool.
at a community center. Sometimes people do things that failed prior because they weren't ready, and it kind of put a bad taste in the mouths of the community. Or one of the worst things you could ever say, well, we've done this before, right? And so in trying to implement something that is practical with a mission, and as you continue to have success, sometimes envy shows up in my community that this thing might work when it's starting to work. And then sometimes there's a thing where people make empty promises, where they say they're going to support, or I'm here for you, whether it's for their name to be on it or political reasons. So I've run into a couple of those instances here. And so now we have to regroup and collaborate, like you're talking about, and build a coalition with individuals with the same priorities and mission.
As you brought up a really good point of talking about, like, there can be some community history where people have a bad taste in their mouth about something because it could have been a great program, but it wasn't done well. How did you combat that when you walked in to do some of those programs?
We just were consistent. If you're consistent, and also having great leaders who know what they're doing, who are competent in the area. So we had a great team of computer coders who could relate to the kids, and we were in a great position as far as the kids flowing through that community center, and we fed them food. So pizza and little juicies go a long way.
It is so true. I mean, like I said, being in the South, if we don't have food places, yeah, food is people's love language for sure. But I want to highlight what you said about consistency when we're talking about implementation. I think you're so right. People, it doesn't matter what community you've been in. It happens in rural communities, it happens in urban communities where there's an influx of money coming in and everyone runs to get it, and then they start to try to implement something, and then when the money dries up, they leave, and then a great program stops, and then it starts to create animosity for new people coming in to do programs. And the one thing I can say is to reiterate is what you said about consistency. We have to show up and model the behavior we want to see, and prove to them that we're there for the long haul, prove to them we're going to communicate, that we're going to collaborate, because it doesn't matter what community you've been in, they've been hurt at some point from someone trying to use their youth for something. So I love that you brought up consistency, and then also the leadership piece. And so many of you in this room are the leaders that people need to see, doing really great things, but also making sure we're highlighting those other stakeholders that are great leaders in the space as well. Anyone else? So we've implemented it. We're getting it. We've done our pivots. We made sure we have sustainable resource, all those things. Now we have to evaluate it. And this is the other evaluation primer. And I love Fran said that she has hard copies in the office for you guys too. So make sure you reach out to her so that you can get these, because they do. It's just a good one-stop shop to get quick information on both implementation and evaluation. But first I want to see, oh, did you want to take a picture? I saw a picture coming up. Did you get it? I want to know how you feel about evaluation before I tell you how I feel about it. So in the chat, what is one word that best describes evaluation to you? It's worthwhile, it's tedious, it's joyful, it's fear-inducing, or if you say another word, you have to share. So how do you feel when I say evaluation? Oh, Bethany comes in strong with worthwhile. Tedious. Another worthwhile. A and B. Christina, must be our names that we both feel fear-inducing from the word evaluation. So worthwhile and fear-inducing. Stressful, Julia says. Worthwhile. A and D. Yeah, I definitely listen. I jokingly say this all the time that my father is a nuclear engineer, and is so good with math, and he ended up with 2 children who their worst subjects are math. And one is political science and one was psych and social work. Like both of us were like staying away from anything with numbers. And so when I first got into this space and knew we'd have to be doing evaluation work, I was nervous. It was fear inducing for me. I'm like, what if I mess it up? What if I don't communicate it right? What if I do something weird with numbers? All of those things. And what I can tell you is that what I have found is I was making myself crazy for no reason. It really is much easier than we think, especially if you have the right data and the right people around you. And I was looking at some of the E's. Educating, I like that. Evidence creates a cadence of accountability. I love that. So the fact is, we need it. It is worthwhile. It is something we need for evidence to create that accountability. We need all of it. We need to be doing evaluation, doing it well. And if you are someone who's like, this is hard and it also gives me heartburn, I promise it can be simpler than we're making it. So we're going to talk about what are some ways we can look at evaluation now. So what we want to do for our coalition evaluation is first thing is make sure we have the right data we're looking at, because remember, whatever's on our logic model that then we have mapped our strategies to, that is what we're accountable for changing. So we can't change all the data in all entire world. We're responsible for the data we choose to change that we say that our strategy is going to impact. Then we got to get good, and we're going to go through each one of these in more depth. Then we got to get good at documenting our coalition's work. Because like I said, it's not just that the numbers changed. We need to know what went into getting those numbers to change. For not only to make sure that we can really get streamlined into making our impact, but also so we can communicate with funders and the community how much work it takes to make those changes we're seeing. Then how do we communicate what we're doing with telling your coalition story and make sure we have a data collection plan, a roadmap? So if Tanya wins the lottery and moves away, other people can make sure they're tracking the work. So why do we evaluate? What are the functions? And you guys have already brought this up so well in talking about evidence and the idea that we need money and funders are going to like it. So we need for improvement, because this is going to tell us whether what we're doing is working so that we can tweak it. And it allows us to be better at coordination, because we can see where can someone else fit in for a gap? Where could we communicate better? It provides accountability. Are we changing what we said we were going to change? It allows us to celebrate, which we don't do enough of when we do something really well. And then finally, if we do all this, this is really sustainability. If we can prove all the work we're doing is working, people want to fund that. This is what I say over and over again. People want to fund things that are working and collaborations when people are coming together. That's what funders love. They want to see numbers change and they want to see people working together. So I want to take a minute to talk about coalition versus program evaluation. And we're in both of these hats, right? Because we're doing community level strategies and we're doing program strategies, but most coalitions have a little of both. So I want to talk about what are some key differences. With coalition evaluation, our focus is the community. We want to change the entire community. When we're looking at program evaluation specifically, we know the audience, right? We're going to work with Mrs. Clark's 5th grade class. That's who we're looking to impact with our program. With coalition evaluation, we can account for influences. We're able to say we influenced this change. We were able to, if we change the 30-day use rate, we were part of that change, right? With program evaluation, we're able to control the influences. We know if little Susie showed up late or didn't come to 4 out of the 5 classes that was at Mrs. Clark's 5th grade class, right? We're able to control some of what's happening in that classroom and know when something is an outlier in a way we can't with coalition evaluation. With coalition evaluation, we can report contribution. So we can say we had some part of this, but we can't say we did it all because there's a lot of stuff happening in the community. With program evaluation, we can distribute attribution. We can say we did something because the pre-test and the post-test show that something happened here and this program was the difference. So an example of this, you guys, some of you are already talking about life skills a little, is the program evaluation for program life skills. So we know it's based on prevention science and it has clearly defined objectives. We know it's available in English and Spanish for these grades. There's a parenting component. There's instructor training to make sure you do it right. I actually was cleaning out and just read the life skills book again. Includes implementation fidelity and evaluation tools, lines with state curriculum standards, and they've looked at it in multiple settings, right? So we know if we put life skills into place, we have the program participants, so Mrs. Clark's 5th grade class, and we got a pre-test, and then we have the intervention, and we have a post-test, and then we have a group, you know, Mrs. Rutley's 5th grade class, and they did a pre-test, but there's no intervention and there's a post-test. So we can show in that evaluation point the participants receiving the program have changed compared to those who did not receive it. So again, with coalition evaluation, though, it's messier. I told you community work is messy. There's so many things happening. We can report how a coalition contributed to community level data, but we can't say we did it all because we got things like COVID that happened. We've got things that are happening at the police department in terms of prevention. We have things happening in the school system, the hospital, Boys and Girls Club. There's a lot of different factors that come into play. And this is twofold. We don't want to say we did everything right, but we also don't want to be blamed for everything wrong. So when you look at something like when COVID came into place, we saw a dramatic drop in vaping. Well, we can't say we did all that. That's because the kids weren't together. They weren't sharing stuff. But then we also saw at the same time a ginormous uptick in alcohol use because everyone was sitting at home with what was accessible to them. That's not our fault either, right? There's stuff that happened. COVID happened and it changed the community. And then we had to adjust to those changes, right? And so we can say that we contributed, but we can't say take it all on either when something good happens or when something bad happens, because there's different coalition efforts, there's partners, there's the economy, there's different demographics and community events. So all of these things can funnel down. But what we can say is we did all of this work and we contributed to a change we saw in the overall numbers. So again, the ultimate purpose of local coalition evaluation is to document contributions. We contributed to this community level change, but not to say we did it all, it's just us. And what's also great about this is this makes sure that partners really are involved, because we are saying that it isn't just us. It's because law enforcement did their job. It's because the school system did their job. Now, I mean, if they didn't, we won't add them to the list, but for the ones doing it, yes, you were part of this. That's why coalition matters, because we're all coming together to make these community level changes. Any questions about coalition versus program evaluation and that difference? So I want to talk about 3 parts of coalition evaluation. The first is making sure we're looking at the right data. Then how do we document our work? And how do we tell our coalition story? Like I said, we overcomplicate this when we think about coalition evaluation. I think that's why it gets fear-inducing. So I think we get wrapped up in surveys and how do we do a survey right, and focus groups, and how do we do a focus group right? And this is where, yes, we need great student survey data, and hopefully your state is supporting that and providing great evaluators. If not, you have funding to have an evaluator do that. But once it comes to getting that data, that's where we can start tracking it and putting into a plan. It's not about us putting together a survey. Now it's taking that survey data that's from the assessment and making sure we're aligning it with the work and tracking the right numbers. It really is about, are we tracking the right numbers and making sure our strategies line up? So I know I keep going back to the logic model. That's why I told you, if you were with me for the very first session when I talked about logic models, it works if you work it. If you're doing something and it isn't impacting something on your logic model, why are you doing it? Because this is the data that we're saying that we're going to be held to, regardless of whether your state does it like this in a 2x4 logic model, or our state does some crazy chart. I'm not really sure who came up with it, but no matter how it's laid out, it should have the data that you say on it and why you're going to change it, right? So we want to make sure we have the right data on the logic model, because this is what we are saying we're going to change. So here we're saying that the high school age youth attend off-campus parties near the ABC college campus where alcohol is accessible. So we want to make sure this is the correct data. That if we do something about high school students attending off-campus parties, that we're going to see this data change. So here it says 52% of ASU students report they received alcohol for free at a party. Does someone see a problem with that piece of data when they're thinking about the local condition? Does anyone see what's wrong with that? I'll give you a minute.
Would it be what parties did they receive it from?
Okay, there could be what parties?
I mean, was parents providing it? Who was providing it at what party?
Okay. We're asking some of the right questions here. We'll look at where we're talking about who we're trying to impact when we look at the problem statement. So it says 9th through 12th graders and 9th through 12th graders. So our population we're looking to overall change is 9th through 12th graders. And then we're talking about high school age youth attend off-campus parties near ABC campus. But who's reporting they're getting free alcohol right here? Yes. So ASU students are college students. So I'm not saying it's wrong. I think, Tanya, you're asking the right questions that we need to do to fill this out better. Is that if we're saying we're impacting high school students and we're going to put something into place where we're tracking that, college age students is not who we need to be talking to. So they're saying they receive free alcohol, which is, we probably don't want them receiving free alcohol, but we want to make sure that high school students are telling us they're receiving free alcohol. That way, if we change their ability to get to off-campus parties, we're going to see them telling us that they're seeing less alcohol, that they're not getting free alcohol. Because right now, if we're able to do something that stops high school age kids from getting to campus, say we do something to make sure that doesn't happen, it's not going to change the ASU students from saying they're getting free alcohol, because that's probably still going to be happening. So making sure that our data aligns with what we're talking about, so that as we're changing that local condition, we're going to see that data change. So that youth focus groups report most parties where alcohol is provided occur in off-campus housing. That one, if we do something about them being able to get it, we come back and do another focus group, we should see some of that change. Yes, and some may be of age, you're exactly right. So we just want to make sure we're aligning this with the population impact. So like when we look at something like youth obtain alcohol from local retailers, we're saying that they're failing compliance checks and that they're 27% reported that they purchase alcohol themselves without being carded. Both of those show us that that is true, that youth are getting alcohol from retailers. And if we're able to put together a set of strategies, policies, and programs that change that youth are able to get access to retailers, we should see both of those data points change. So that's what we want to ask ourselves. The same thing comes up when we're looking at youth are exposed to excessive drinking at ASU tailgate parties prior to football games. And here you see that law enforcement issued 188 alcohol-related citations. I'm looking at the data point number 1 under 1.2a. 45% were related to ASU events. My question there is, who was being cited? Was it youth? Is it parents that are with youth? So again, we just want to make sure that the right data is in place. This is great data. It belongs in our assessment. It might even belong in another piece of our logic model, but we want to go back and make sure this is as tight as possible. So when putting strategies into place, we're going to see these numbers change. So as we're going and confirming our data on the logic model, we want to ask ourselves, what is good data? And like I said, there are a lot of pieces of data that are beautiful for your community assessment. They're going to be great for one-sheeters, but that's not necessarily the data we want to continue to track on our logic models that end up in our evaluation plan, because that's where we're going with this. So what does good data mean? We want to go and ask ourselves, for each one of those pieces of the logic model and data underneath, is it sensitive? Will it reflect community change? So that's what I just had you go through and do. I had you said, if we are able to make change here, will we see change here? No, because we're looking at the wrong population. It's not sensitive enough. Is it proximate, which means it's at the community level? So what I've seen a lot, this happens a lot in Tennessee, it's hard to pull data, so people will put statewide data on. The odds of you being able to change statewide data with your local coalition efforts is hard. We're hoping cumulatively, all of you working together are going to change that statewide data, but we want to say what we can be responsible for contributing to change to. So we want to make sure it's as close to our level as possible. So if we're working in a county, it's county level data. If we're working in a city, it's city level data. If you're working specifically in a school system, it's school system level data. That it's feasible, so we can collect it more than once. So that's why, again, I said there's some beautiful data out there that is going to be wonderful in your assessment or to showcase somewhere else in a PowerPoint. But if we can only collect it once or twice, and we can't do it on a regular basis, like quarterly or yearly or biannually, it doesn't belong in our logic model, because this is where we're going to be evaluating if we're changing it. So we have to be able to get that data easily. So here's thinking about sensitive. If the problem, root cause, or local condition changes the data changes, the data will reflect that change. So again, if we're able to do something about high school students smoking at the pit after school, the data that we've mapped to it will change underneath. So I have an example. If fewer parents host youth parties with alcohol, which indicator would best reflect the change in behavior? A decrease in police calls for service. B, a decrease in citations for social host violations. C, decrease in calls to tip line, or other. And I'm looking in chat as you guys are thinking about answering that. Qualitative data is the hardest to track, but also key in its work. It's hard to determine how to quantify qualitative data despite how well it aligns with what we do. I absolutely agree. And you need both. And if you were with me for the logic model session, you heard me talk about, we put sometimes too much emphasis on student survey data. It's important, especially when we're looking at long-term outcomes. We want that. But local conditions are almost always going to depend heavily on qualitative data. So this is where we kind of have to, like you're saying, quantify it. So if we have a youth focus group, how many youth were in it? So 9 out of 10 youth said this. If we're doing listening sessions, how many were in the listening sessions? Now, I do want to say this is where transparency is key. We don't want to say 90% of youth at the focus group said this. We want to say 9 out of 10. If we're doing key informant interviews, 2 out of 3 of the law enforcement we spoke to said this was an issue. So that way we're being really honest about how many people we spoke with, and we could see if that's changed. But you're right. And it's so important. I don't want you to shy away from qualitative because of that. So a lot of people are saying B for this. So decrease in citations for social host violations. And this is really good, especially, so this is where it becomes an art and a science. So if you're already in a community that is implementing social host citations and you're doing it really well, this is a great way of marking, changing, and it will reflect that. Now, if you're in a community like I was, that we weren't doing anything about social host, we might actually see an increase in citations while they start to enforce it before we see it go down. So those are things we have to think about. So it depends. For decrease in police calls for service, that one doesn't work unless it says specifically for social hosting parties. So if your law enforcement is tracking out of all the police calls, 50% of those are underage drinking ones, we could use that. And again, if you have a tip line and you were getting calls for it, you could use the other one. So it really depends on what's in your community that to pick the best data point. Because like I said, if you're not doing anything with citations, you might actually see an increase before you see a decrease. So when it comes to proximate, again, this is just making sure the data collected represents the same definition of community you have. Like if you're a county, city, school, multi-regional area, what have you, you just want to make sure that it's reflective of who you're saying you're going to target. So this could be, again, state, district, census block, regional, whatever. It's just saying that if this is the data and we're saying we have a whole region, it should be regional data, not just one of the counties within that region. So we want to make sure, like I said, the one that comes up most is when people are struggling to find data, they'll put state data in or regional data in, even though they're a county or city coalition. And so just make sure that you're really trying hard to get local level data as close to where you're doing it as possible, because you're going to be responsible for changing it. And again, feasible, that you can collect it over a period of years. And you want to be thinking about the cost of this. So we're not going to be able to do a student survey every 6 months, every year. Most surveys are every 2 years. So making sure that local condition data doesn't have a lot of that survey data, because we can't collect it readily enough to see if we're changing it every 2 years. We want to see if we're changing that data in a quarter, in 6 months, in a year. The level of effort to collect it. So how much time do we have to put into focus groups? Is it easier to get some archival data instead from law enforcement or hospitals that we could get maybe on a quarterly or every 6 month basis? What's the format? Is it culturally appropriate? So making sure we're really thinking about, can we get this data? Is it cost effective? How much effort needs to go into it so that we can continue to track it over time? So again, you're making sure everything aligns. You're going back to the data in your logic model and saying, is this sensitive? So here, if I do something about retailers selling alcohol to minor, if I implement these 7 strategies, we're doing vendor training, we're doing compliance checks, will I see compliance check data change? And will I see minors in possession, arrestees reporting obtaining alcohol from retailers change? Yes. So those are sensitive. We're also assuming this is coming from their local police department, so it'd be proximate. And is it feasible to continue to collect this on a regular basis? Yes, because this is getting a report from the police or from the courts. So that would make that fit. Yes, it is sensitive, proximate, and feasible. Then we go back and say root causes availability. So if we do something about the availability of alcohol, will it change 8th through 12th graders reporting alcohol is easy to obtain? Yes. Will our focus group participants report alcohol readily available from retailers? Both of those talk and speak to availability. So they are sensitive. They're coming from our student surveys. So it's proximate, and it is feasible to collect that again. And then finally, with underage drinking, we're looking at saying that it's a problem. If we are able to impact underage drinking, we should see 30-day use change, and we should see binge drinking change. And again, so that makes it sensitive. It's proximate because those are our students, and it's feasible because it's part of our student survey. So you really are just going back and doing a gut check to make sure you're impacting the right data. And most of the time where you need to do that gut check and go back is under this local condition part, making sure it's saying exactly what we're putting in this box. This data is reporting on that.
It's nice with all this new technology. You just gave me a couple ideas using those codes, those barcodes to collect data with the surveys. And then if you got a smart person and you're a techie person, imagine having a survey, creating an app. Kids are always using apps. So if you have someone to design a quick app and they're continually going on the app, updating information, that'd be sweet.
Yeah, absolutely. And we have to think, especially if we want to stay on top of emerging trends and not do the whack-a-mole approach when we're looking at this, if we can get data faster, the better we're going to be. We know student surveys are great. We need them. But thinking about like what you're talking about, Marcus, and ways that we can tap into archival data from our law enforcement that we can be looking at every quarter, every 6 months, every year is going to allow us to pivot faster and make sure we're seeing those changes. So again, you have your evaluation plan because you have your logic model. So really your evaluation plan is just taking and transferring the information from your logic model into that. So we're saying what is being evaluated, it's your logic model, your measures are underneath that. The baseline data is that first like 30%, and 2023 said that they drank in the last 30 days. The data source is where it came from, whether it's a student enforcement, and then how often you're going to now collect that. And that becomes your evaluation plan. And I'll make sure this goes out so you have this template. You can use it however you want, but it's literally saying, here's the measure. And by measure, I mean the question you're asking. So youth reporting using alcohol in the last 30 days. Then you put 30% in 2023 reported that. And then all the other years you're going to collect it, where it's coming from, your student survey, and we're going to collect it biannually. And as you go down, you should see collection frequency change and get more often as you get closer to the local conditions. So we know that's going to be every 2 years. The problem, there's going to be some of that student survey data and root causes, but we also want to have ones we can collect hopefully every year and root causes. And then we want to see where at least every 6 months to a year we're collecting for local conditions, because we want to see that change in 2 years. And in order to make sure we're doing that, we got to collect it before that to see if we're making change. And so again, it's just taking this and transferring it over. So it's taking your logic model here. You see this one line of logic and saying, okay, our problem is underage drinking in ABC County. Our measures 8th through 12th graders reporting use of alcohol within the last 30 days and our binge drinking rates. In 2023, we had 35% and 18%. We're getting it from the APU survey and biannually. And you can see as we get farther down, it's collected more often. So you're starting to see annual every 6 months, and annually. And if you can get it quarterly, you could put that in. The idea is you're collecting it more readily. And what's great about having it in this way is, like I said, if Tanya wins the lottery and she moves to the Bahamas, someone who takes her place can really look at this, and this is their roadmap from what we've been evaluating. So thinking about sustainability and succession planning, this allows someone to know exactly where they need to go back to and say, okay, great. High school age youth attend off-campus parties. We need to go back and look at this data. The last time we looked at it was 2023. It's time for us to do it again. Tony says, does it matter if your sample is smaller each year the survey is done? So this is where I always say, like I said, coalition community work is messy. What I always say is just be transparent about the data. So we don't want to pretend that there hasn't been a change in that. So we want to put an asterisk by it, especially if it's a great difference. If you're talking about in 2023, we had 80% of the student population be involved in the survey, and then we're looking at 50% in 2025 that were involved. There needs to be an asterisk there where we say that. And then what I say is then go back and talk to your evaluators about how you can really see the difference between those scores, because that is a huge leap. So it's about being honest and transparent about the differences and making sure there's an asterisk on it. And if you want to be really tracking what is our actual change when we're looking at that, you really talk to your evaluation team who's ever putting those surveys on. And I've never seen, regardless of whether I've worked with EMT or PIRE, who haven't been willing to do that math for me. So again, the reason this is important is because it's all built off your community assessment into your logic model that informed your long-term objectives, short-term and intermediate, all coming from your logic model and your strategic plan. Now it all comes together in your evaluation plan, where we're basically saying, these are the objectives we said we were going to meet with the logic model all laid out in one place. So you've already done this work. It's just putting it all in the one place for you to be able to say, this is what we're saying we're going to be held to for the strategies and the movement we say we're going to make in the data. And so the evaluation plan is used to track those objectives we put in the strategic and action plan. Any questions on confirming data on your logic model? So you've done all this work, you've tracked the numbers. The next part of evaluation I want to talk about is how you make sure you're documenting your work that made those numbers change. So how does your coalition document the work of coalition members, partners, and staff to plan and implement strategies that address use and misuse in your community? So how are you currently tracking this? Like outside of survey numbers and everything else, how are you actually articulating the work you're getting done? Do you guys have Excel docs? Are you putting it into a system? How are you currently doing that? Okay, so we have Excel. What are some of the things in your Excel document that you track? I think most people kind of use some type of Excel-like doc. So I was old school back in the day, and I jokingly had something I referred to as the Coalition Bible. It was a big blue 3-ring binder, one of those gigantic ones. And it was separated by months. And everything we did, whether it was agenda or we passed out something or we went to a meeting, it all went in there. And I was able to calculate everything we did off of that. And so I'm going to talk more about what I look for in that. So we can talk about what we need to be tracking to showcase we are doing the work we say we're doing. So this is just an idea. It's not a perfect science, but for those who are like, I have no idea what I should track, I'm only tracking what my funder tells me. A great way of looking at how do we make sure that we're showcasing all the output. So we should be looking at community changes, services provided, media coverage, and resources generated. I'm going to talk through what each one of those means in a minute. And then additionally, we need to be looking at our processes. Where are our meeting minutes? How many calls that were made, emails that went out, etc. So those are the two main areas we want to be looking at. Our outputs, so the work we're doing, and the processes. What are those things that just keep the coalition running? So our first output we want to talk about is community change. I just call this the first time you do anything. The first time you put on a drug take back, the first time you developed a new poster and put it out for the first time, you did a new campaign for the first time, that would count as a community change or a CC. So any modified programs, policies, or practices in the community facilitated by the coalition to reduce substance use. It could be a policy change, a practice, a program, anything you do for the first time. First time equals a community change. Anytime, oh, we get a picture? Anytime after that, it's a service provided or an SP. So this is anything that you're doing that you're continuing to do. So the first time you implement a class, say you're doing responsible beverage service, the first time you do it's a community change. Every time after that, it becomes a service provided. If you're disseminating information, service provided. You're doing a program, a screening, anything that you do, your drug take back events, all of that ends up as an SP, a service provided. So anytime after you've done it the first time, it's a service provided. Then you have media coverage. Anytime you have any media coverage that are designed to increase awareness, you're in the newspaper, TV coverage, you're on someone's social media, there's an awareness campaign. All of that counts as media coverage, so MC. And again, you can add your own too. These are just saying these are some things you should be tracking. And then resources generated is anytime you make money, right? So whether you get a grant, someone donates something to you, there's volunteer hours, in-kind office space, anytime that you've gotten something for free or you're getting more money, it counts as a resource generated. So we say at least you should be looking into those 4 buckets. And then you have your processes. And these are just the internal things. How many meetings did you have? Whether it's coalition or work group meetings. How many internal emails or letters or correspondences went out? What does your website and social media look like? Not related to a specific strategy, just you putting information out about the coalition. What about your capacity building efforts? Did you have some membership recruiting or a member training? And any fundraising activities you would count as a coalition process. And so, and I'll make sure that Fran has to say it out. This is just a form you can use. But like I said, this is just giving you an idea of we should be labeling these and making sure we're at least looking at these buckets. So here you see the code for community change is C. So they're saying there's community change on 4/15/23. The city council passed a social host ordinance. And then it's saying some of who was involved with that. That's an even better if you want to put that. Then you see there's P, which means there's a coalition process. There you see there's a coalition meeting conducted, what they discussed. There's 15 people who are represented. There's all 12 sectors. There's 55 people at the coalition meeting. So you have those outputs. We had a meeting, but also you have the numbers of how many people are at that meeting. Again, this isn't you have to do it this way. It's just that we need to be tracking our output so that we can say, for what we're seeing changes in our logic model, it took 50 community changes, 125 services provided. We had this much media coverage, that it took all of this work. So this is where we stop justing all over ourselves and really show how much work it took to make community change happen. So let me show you some examples of this in a minute. But this is really important because it lets coalitions know how much work needs to be done. It allows us to capture the outputs on a regular basis, again, showcasing all the work. It becomes part of regular reporting. You can make it so it's manual or automated. You can find some way that people are checking in themselves, updating it in a Google Doc, or you could do it old school like I did in some type of notebook. But it really is helpful for showcasing all the work that goes into what you're doing. So this is one way that that showcases this. At the bottom are the months, so January, February, March, April, May, etc. for year 1 and year 2. And then where you see highlighted is major things that have happened along the way over the last 2 years. So everything from safe celebrations to new staff hired to leaders pledge to the first speakers events. And what you can see is that as they got better at implementing, they had higher output. So smaller outputs in the beginning, under 10, all the way up to 60, that got us to having a Young Leaders Academy and having this first speakers event. So it shows how much work went to these over level changes. And here you can see it broken down by community change strategy. So those 7 behavior changes, where are we spending most of our time? And it's showing that we're spending a lot of our time in providing information and providing support and altering access. The smallest amount of our time right now is in modifying policy change. And this is important to, as you're growing, and we had to do this, all coalitions start out with a ton of providing information. And as we get better and better, we get to shift over to seeing more of those environmental change, where that gets a bigger part, and we're seeing, instead of 6%, 15, 20, 25% in that area. And then also you can see they're able to pull it out by goal. So they're able to say we're spending 31% of our outputs on underage drinking, 17% on building community partnerships, and 52% on alcohol. And so this allows us to say, is this where we're getting the most funding? Are we getting the most funding for alcohol? Or are we getting a lot for another, like for cannabis use, but we're not actually spending our time there? So this allows us to get more strategic about where we spend our time and really figuring out if it's aligning with what we're trying to do. So a way of looking at the outputs. Any questions about coalition outputs? Okay, and finally, we want to talk about telling your coalition story. And it's easy to be like, we're doing a great job, give us money, and we all win. But we know we need to articulate our successes better than that. And so if we have these outputs, we've made these changes of data in our logic model, how can we best communicate it to the public? And this is where I say, one pager does not meet all. We really have to be strategic in thinking about who our audience is when we're doing this. So annual report cards, 1-pagers, one-on-one meetings, presentations, partner events, press releases, town hall meetings. You have done, if you're in the coalition world long enough. What I'm asking you to do is be more strategic about it and saying, what have we done really well? And what do we need to do more of, and make that into the story for a particular population? So if we're talking about parents, what have we won with? What have we done really well with that we want to show them there's a decrease of, that has an impact on their young people? And what is our next call to action for them? If we're talking about school board, what are those things that have done really well that we want to articulate that we've had successes in? And then what do we want to showcase we could do better if they worked with us? So it's getting really targeted and strategic about why we're developing these one-sheeters and who's our target audience for. We want to make sure that we're telling the good and the bad, and to a diverse group of stakeholders. Our job, if we say that we're serving the entire county, is to serve the entire county. And it means that we need to disseminate all of our evaluation findings, even if they weren't perfect. Maybe the rates went up. That's okay. We saw that during COVID. Like I said, we saw dramatic decreases in tobacco and vaping and increases in marijuana and alcohol use. We have to say that. We can't cover that up. Be transparent about it. We can say where we had wins, but we also have to say where we have gaps. Making sure that we're talking about this and thinking about it in plain language, depending on who we're talking to. Like, yes, if you're turning in the report to funders or to commissioners, it might be fine to use all of that survey language. But as we're talking to other people, we want the whole community to understand the work we're doing. Making it as simple to understand as possible is important. Making sure we're getting it out in different languages, in different areas, making sure every school is getting information, the parents within that school, and sharing any lessons learned or any holes we're seeing. Tanya put, Are you aware of a collaborative group's performance? I'll have to look at that, Tanya. Thank you for putting that in chat. So again, we want to make sure report both good and bad. And that's where you can build more partnerships, and the transparency is going to build trust within the community. So I want to showcase some of these that we've seen in the space in terms of telling your coalition stories. And again, I want you to really think about, and I was bad at this early on. I do a one sheet and I'm like, we can hand it out to everyone. But again, what you want to send to Kiwanis versus the school board versus parents should be different depending on the focus that you're trying to get out of them. So this is a larger one that you saw highlighted, where we're looking at Prevent Coalition. This is out of Washington. And they're saying prevention works, work with us. Parents can reduce youth access to cannabis. And they're showcasing they've had a 7.1% decrease. And then they're saying coalition tools equal healthy kids, and they have those tools available. And then there's a call to action here for coming to an online conference calls about these parent toolkits. What do we like about this? And what do you think? Any feelings on this? It's simplified for everyone to understand. I agree. I love that it's easy to read, that you see a graph you can see where it's going down very clearly. Anything you change? Visually pleasing, I agree. It's not too much. It has good white space.
What caught me is the healthy kids kind of marketing tool.
Say it. What was that, Marcus?
What caught me where it says healthy kids,
Yeah.
when it comes down to it, that caught my eye first.
Yeah, I like that too. It doesn't feel blaming or anything like that, saying we can all have healthy kids. So I love that too. I think they use the right language. My even better ifs are, I do think we need a QR code or some way that people can register for that conference call they want them to come to, because they'll have that call to action. And when we're thinking about numbers, remember it's really hard for people to understand what 7.1% is or what 51% is. And so sometimes it's easier to be like, in a classroom of 25 people, this is the reduction we've seen. Making sure that we're showing numbers in different ways for people who don't, and listen, for me, unless it's 50%, you could throw it out the window. Finding other ways we can communicate numbers. I'm not saying this is wrong, but it's just an even better if that might be helpful. And again, this is why not doing it just by yourself at your desk is important, and having lots of people read it. I used to go and bring my flyers around. So if I was going to Walgreens or I was shopping somewhere, I'd be like, do you get this? Is it getting the right thing? Do you understand what we're trying to say? Making sure that for whoever the target audience is, so if it's parents, that we're asking sets of parents if we're getting the right message across with it. Another example, this comes from Safe Coalition in New Jersey, and they're also looking, they've had a lot of changes. They're really showcasing that they've had a lot of decreases in their rate. Sorry, I see something coming up. Maybe making the meeting info a little bigger font, if that's the ask. Yeah, absolutely. Wherever you want people to look, remember, we're not ever doing this just to do it. There should be a call to action with each one of these. And so if we want more parents to go to something or be involved, as well as showcasing the successes we've had. So here they want to spread the word to lock it up. They're showing that they've seen a reduction, that it's harder for them to get alcohol, that our coalition needs you to lock up their meds. Here, I would say this is great information. Maybe again, looking at it less percentage wise and more like in your average classroom or 1 out of 10 kids, some way that they can really see it in a more visual way of thinking about, hey, my child's group of friends is about 10 kids, and out of their friends, this many people was impacted by this, or we've seen this decrease, can bring it home more for people. And then making sure the call to action is as clear as possible. And again, this is great. All this information is important. It's just making sure we're being really strategic with that, getting across what we want to get across in it. So as we're telling our coalition story, make sure we're identifying key points that describe the results of our efforts, that we're using a mix of quantitative and qualitative. We want to make sure that we're not just giving numbers, but we're giving the context to those numbers, that we're being creative in the way we're sharing our successes and engaging partners in it and addressing specific audiences. So making sure that as you're developing things, it's not just for you to give out, it's for partners. So how can we make sure partners are sharing the information? Can we give them talking points as they're going to their association meetings or they're going to the school board, because maybe you have a school board member that sits on your coalition? How can we give them the information to communicate and tell the coalition story? So we want to build a plan of attack to make this happen. And it doesn't have to be hard. It's just, again, getting you to be strategic about who are we trying to target, and that's the audience. What do we want them to do? Why should they do it? That's the what's in it for me or with them. What data do they need, and how are we going to give it to them? Right? And so it literally is as simple as having a little chart that says, and like I said, you're already doing this, but this is making you be strategic about, for the changes we've seen, we've had these wins. This is what we want to see next. Who needs to get this information and why? And so this just allows you to build a communication plan of how you're going to do that. Let me just show you an example of that filled out. If we're talking about the police chief, and we know we've had some wins around compliance checks, we've seen some retailer wins. We want them now to enforce minors in possession in local parks. We want them to collect even more compliance checks, and we want them to respond and enforce social host laws. So why would the police chief want to do this? Well, they want increased public support for law enforcement. They want safer communities. They want fewer calls for service. If it's a sheriff or elected position, it could be they want to be reelected. Right? And so what information do we need to get the police chief to understand this is important? We want perception data, and we want of law enforcement and perception of risk from use. And we're going to do it by having one-on-one meetings, meeting with officers during staff meetings, and providing periodic updates on social media. So it's just getting really specific with what wins do we want to communicate with them, and then what do we want next for them? Because remember, we're always trying to do a call to action of how we can keep this ball rolling for sustainability. So getting specific, this allows us to then figure out, okay, what can we put together for a one-sheeter for police? And for parents here, if we're looking at them, that we want them to secure their alcohol and support a social host ordinance, what do we need to put in a one-pager or in some type of presentation to get them to move on that? Right? So we want them to know where youth are assessing alcohol. We want them to know about police reports. We probably want them to know what young people are saying. And then how can we put that into flyers or open houses or education events? So again, you're doing this work, you're putting some of these things out there already. I'm just telling you to look at it through a new lens of being as targeted and strategic as possible when you put it out so you get more impact. So we talked about your 3 parts of coalition evaluation. You need to confirm the data on your logic model, make sure you're tracking the right thing. You need to document all the work you're putting into it. So that way you could showcase both everything you've done and how it contributed to the change. And then you got to put it in a pretty package to get people to move on the next level of things that you're talking about doing. Oh, sorry. Any questions on implementation or evaluation or comments? I want to encourage you to always reach out for support, whether it's with the staff with Prevention Action Alliance, or CADCA has great cds@cadca.org that can support you, especially when you're talking about evaluation. They can be super helpful figuring out. Don't recreate the wheel if you're looking to do a focus group or survey. They have things already out there for you. Thank you so much for your time and attention. I look forward to hopefully seeing you at the in-person event coming up. Thank you so much. I'll stick around for any questions, but I'll hand it back to Fran.
Great. Thank you, everyone. Thank you, Christina. I've just sent the evaluation link in the chat. If you could please fill that out so that you can get your CEs, and then we can evaluate ourselves. And then as well, I've sent the link for the in-person sustainability training. That is our SPECA Fall Fest. It's coming up in 2 weeks. It's going to be in person here in Columbus. It's going to be a great time. We will have food and drink of coffee and that kind of stuff. So it's going to be a really good time. We're going to be talking about sustainability. So if you can attend, we would love to see you. Other than that, I don't have anything else. Thank you for being here, and thank you for spending your time with us today.
Thank you all so much. Have a great rest of your week.
Tanya, I can check on if you are registered or not.
Yeah, because I sent it in, but I don't think I got anything back.
Let me check. Because it is a different registration system, so it might not have popped up. I see you registered.
Okay, so are you guys sending us an email confirmation? Because I don't think I got anything.
Yes, I will make sure that an email confirmation goes out. I don't know why it wasn't automatically going out.
Okay.
Thank you for letting me know about that, because it looks
Right.
like none of them have the automatic email confirmations haven't been going out.
Right, because I didn't see it on my calendar. I was like, I know I registered for it, but I needed to be on my calendar so nobody will
Oh.
book anything on me on there
I'm
for
the same way.
Yeah.
And yes, Noelle, CEs are available. There'll be CEs, 3 hours of P1
Okay.
for the in-person training, and then today was an hour and a half of, I think, also P1.
Okay.
Yeah.
Thank you.
Thank you, guys.
Bye.
And Fran, I'll send you all the stuff from today so you have it.
Perfect. Thank you.
Any other questions? Thank you all so much. Fran, if you need anything, let me know.
All right. Thank you, everybody.